Hello, everyone. Thanks for joining us today. I'm here with Celeste Tyrell, the Director of Online Learning for AJJ, and I'm Brett Svensson, a Georgia GAPNA chapter member. Today, we're going to talk to you a little bit about the GAPNA Exchange, which is one of the really awesome things that we have with GAPNA for us to connect with each other and do a whole bunch of other cool stuff. And then I'm going to tell you about the GAPNA Leadership Institute project I've been working on, which is about our online presence in social media. Our objectives for this session are to explain the purpose and features of the Exchange, list at least 2 benefits of using the Exchange, identify how GAPNA uses social media and the types of content that impact the viewership, and last but not least, describe current efforts being made to increase GAPNA's social media content, diversity, and presence.
Thanks so much, Brett. So as Brett said, my name is Celeste and I work at the GAPNA National Office. I work with GAPNA, but also a few other nursing organizations, and I assist them with their online communities and their social media. So GAPNA Exchange started in 2019, early 2019, and I track data on GAPNA Exchange just to see how it's doing and what type of engagement our members are having. And as you'll see here, I track the unique contributors, so the number of unique members who are making posts within the community and the number of logins. And the reason I want to show this to you is because you'll see that the number of logins is significantly higher than the people who are actually contributing. And the reason for that is we always have a group of people that some of us might call lurkers or silent participants. And even though you aren't making posts, some of you may not be, you might be reading everything that's going on, logging in and engaged with the community and enjoying the discussions that are happening there, but perhaps you aren't making posts. So if that's you, I'm hopeful that perhaps after this session, you might be more encouraged to make a post and get involved in the community. But just know that if you choose not to, we truly value you as a silent participant in GAPNA's Exchange. So what is the purpose of GAPNA Exchange? Why does it exist? First of all, it's a website that is also mobile responsive. The reason I mentioned it's mobile responsive is that we know that we're all on our phones all the time, so it can be accessed from your phone and from your desktop. And it is a website that's sole purpose is to connect GAPNA members and facilitate beneficial communication. It's a place that you can go to connect with other colleagues, ask questions, and get informed information. And we hope that many of you are using it that way, and that if you aren't yet, you'll give it a try after this session. So the other thing I track is the number of posts that are happening regularly. And you'll see here, we had a spike in the first quarter of 2020. I believe that this spike has happened because of what's going on in our world right now, a pandemic and COVID. And so, I think now more than ever, colleagues need to support each other and need to have a way to communicate and get really great information about how this is impacting your practice. And I think that this data shows it's become more valuable to you since the pandemic has started. Brett, do you have anything that you'd add to this about the value of the community in this time?
Yes, absolutely. I think seeing that orange bar really high in January through June makes a lot of sense. I know for me, and for all of us, I'm sure, working in the healthcare industry, and for me working in long-term care in a nursing home, you started back in February, March, not knowing what in the world was going on, and new information was coming out practically every single week, sometimes more than once a week. So I'm sure all of us were constantly looking at guidelines. I know for me, anytime something was posted on the GAPNA Exchange, I was clicking on it in my email and kind of seeing what it said. I can recall specifically, for example, Michelle Mosia, one of our esteemed former GAPNA presidents, posting a lot of information on there too. And so every time I saw somebody posting an updated guideline or people asking about what were you doing in your environment, I was really apt to want to read that to figure out what are you doing? How does that fit with the guidelines? What's your state like, or what's my state like? And just trying to figure out what in the world was going on and how to do it. So I found it very, very valuable during that time.
Thank you, Brett. And I hope that, it's been valuable to many of our members as well. So I'm going to just do a brief overview of GAPNA Exchange. There's a lot you can check out later, but I'm going to go through the basics. Every member has a profile. Even if you don't know you have a profile, it's there ready for you to fill in. GAPNA pre-populates your profile with the basic information we have on file for you. So your state, your employer, your first and last name. It's waiting for you to come update it and show people your picture and add more information to your bio. You can sync it to LinkedIn if you don't have time. So we encourage you to do that. GAPNA Exchange is an overall community that has a few sub-communities. The Open Forum is one of them, along with committees and our specialty interest groups. The Open Forum is a community that every member is automatically a part of. And so you might see that Open Forum daily digest that comes into your email in-bin each morning. That includes the communications that happen the day before in GAPNA Exchange's Open Forum. So if you're wondering, well, where is this coming from? It's from GAPNA Exchange, and we encourage you to log in and check it out. And of course, all of the discussions that have happened, there's a history available in GAPNA Exchange. Of course, GAPNA Exchange is a spot where you can connect with other members and ask them questions. So regarding the discussions, one of the great benefits is that all of the email discussions are archived here. So how many of us get 100 emails and we skim it and we're like, oh man, I want to read that later. And then you can't find the email or you delete the email, but you know, okay, I know somebody was talking about COVID symptom screening. I think it was about a week ago. You can go to GAPNA Exchange, type in any word in the search and refine it based on what you're looking for when it was. You can refine it based on how recent it was, based on if there was a file attachment. You can even search by author. So, you know, Brett mentioned Michelle Mosia. If you remembered it was her, you can search by her name. So this is incredibly useful if you haven't had a chance to read through the emails, but you want to catch up on discussions that have happened. You can come here and there's an indefinite archive. It goes back as long as we started and it'll keep going. So what a great resource if you're looking for, you know, connections and communications from members. You can come here anytime and see all the discussions that have happened and even chime in late. You can add to a discussion even if it happened 3 weeks ago and you have more information to add. So we encourage you to check out the discussions that have already begun. You can also search for members. So now, of course, we won't be on site this year together at a meeting, and it might be a while before that happens, but how often have you been at a meeting and you meet someone and you sort of remember their name, you think that you remember their employer, and you want to connect with them or ask them a question? We have a member directory that's part of GAPNA Exchange, and you can come in and search by their basic information or even a more advanced search. Now, just like on Facebook, you know, you're not going to see all of their information right away. So if you find someone, you'll want to add them as a contact, or you can send them a message. If they're not a contact, you'll only see their very basic information. So you'll see their first and last name, their city, state, and employer, as long as they haven't changed their privacy settings. We do encourage you to send a message to another member and make contacts this way. Of course, you can adjust your privacy settings so you don't show it all if you didn't want to. That would make us sad, of course, because we think it's a great way for you to connect with each other, but you can do that. Or you can adjust your privacy settings so people see more about you before they become a contact with you. So we encourage you to check this out and make some connections. And of course, how do you get started? So if I've piqued your interest at all, well, what do? Visit GAPNA Exchange and update your profile. It's really easy to do. You just look for an icon in the upper right and you can edit your profile. But then the next thing is post a message. Just click on participate and post a message. And it can just be an introductory message. You don't have to have some groundbreaking information to share. Just say, hey, I'm Jane and I'm from here and this is what's going on with me in my practice right now. We encourage you to do that. There may be a lot of people right now who you know, are a little nervous about doing this type of thing, but just make a post and see what happens. You'll never know until you try. So I really encourage you to do that. And if you go to do it and you have questions, you can reach out to me at any time and I can walk you through what you need to do to get started in GAPNA Exchange.
Thanks, Celeste, for all that useful information about the exchange. I just want to say to any of you watching, definitely use it. I can say that over the last year, working on my leadership project and just being on the awards committee, I needed to find people. So I sent them messages all the time in the exchange and people would respond. And at the least, I encourage you to put maybe a work email in your profile. So if people want to reach directly to you through an email, that works really well too. So definitely use it. I found it really, really useful. So now I'm going to transition into talking about my Leadership Institute project. Some of you maybe learned about this last year, but I'll just quickly review the basics of the Leadership Institute. It's something that GAPNA just started for the first time, so myself and a few other fellows were paired with a mentor over this past year in this 12-month program, and there are a few of us who are from different healthcare backgrounds in different parts of the country. I was paired with the lovely Deborah Dunn, so she helped lead me through this program over the last year. And the overall focus is to just help develop leaders, as well as give the fellows an understanding of the national organization, how it works, and just kind of get that inside look. So when I started looking into what to do for my project in this Leadership Institute, the question was really, really big at first. And it was something that had pulled over from prior years with some other communications committee members. And they wanted to know, could we make the communications committee a hub for GAPNA content? So as Deborah and I talked, we realized that's actually a huge question. So for the sake of a small project to be completed over a year, and in retrospect to be completed where COVID kind of threw a wrench into the middle of it, we narrowed it down to me just working with Celeste on looking at our organization's Facebook content and really just kind of taking a deep dive into that. So why do we even have it? What's the point? What's the point of Facebook and social media and all of this? And does it, or how does it relate to organizational growth? We'll talk about this a little bit later, but some of the obvious answers are, of course, connecting members. I think for GAPNA, you can get your message out there. You can, post updates on clinical resources, some of the things people really look for, and things I get asked all the time by students, and I see other colleagues posting, where can I go to find the most updated information on infectious disease and long-term care? So it's great to have a place that says, well, this organization is an expert in this, and I know if I go here, I'll find what I want. And maybe that translates to increasing membership as well. For the rest of this presentation, just to give you an overview, I'm going to show you kind of what I found in the social media for other organizations, what I found for GAPNA, and then how we might be able to diversify that, some of the new things Celeste and I tried over the last year. Something kind of fun I found when I was doing a little background research was from the American Geriatric Society. I don't actually know who they surveyed or how they got this information, but I thought this graphic was kind of cute, where they said that your geriatrics health professionals are most active on their social media late in the day, that they tend to be on Twitter, and that they're most engaged in sharing news and research. So it was fun to think, is this me? What's me? What's not me? I'm probably on my social media way more than 2 to 6 p.m., but I found that kind of fun to think about. So here's a quick snapshot of kind of what I looked at back in the fall. And this was around October, November 2019. So keep in mind that it could be totally different now, but this is what I looked at as I started going into my project. I looked at different nursing organizations and their social media content pages. I'm not going to name them here, so I've de-identified all of that because we're not going to do anything that highlights, or in a good or bad way, other nursing organizations, because we're all part of the same team. I did look at some more physician-focused groups, but it turned out kind of their content and their trends really had no relation to what we did. So these are just other advanced practice or nursing organizations. So group A, you can see that I put out how many Twitter and how many Facebook, I would say, followers they have. So in this organization, they've got a lot of followers, but they have a lot more on Facebook. And over the course of about a month in November, they had 30 total Facebook posts. And here I have listed for you which posts or the types of posts had the most interaction. I have here most likes, but that includes things like a heart, or something like that. You have all those little emojis you can choose, the angry face, whatever you choose. Just counted that as general interaction. So you can see that spotlighting nurse practitioners, featuring a member. There was a really cute Halloween post that people really liked. And then there was a post that got 480 likes per se, but it was a very political and a very polarizing post. So not all of that attention was necessarily good attention. Another organization I looked at didn't have Twitter at all, but they definitely had some Facebook followers. This group only posted about 4 things in November, but the most liked one that was pretty active was one about Nurse Practitioner Week, which, by the way, if you forgot, Nurse Practitioner week last fall was in November, so all of this makes sense. A third organization I looked at also had more Facebook followers than Twitter followers. They had well over 45 posts for just 1 month. So that's more than one per day, which is a good bit. The most liked or shared posts were about STDs, something about grant funding, something in the local news, which is always fun to see somebody you know or something that kind of relates to your town. And then they also had another post that had a lot of likes, but it was an article that was probably written by a bot. So it was a really poorly written article. It was a really kind of polarizing article. It was just super, super weird. So again, I don't know that all of that attention was good attention, and don't really know how it reflected on that overall organization. So here is our GAPNA social media snapshot for back around November-ish, October-ish, 2019. As you can see, we have followers both on Twitter and Facebook, but we do have more Facebook followers. And again, these numbers might be different now because this was several months ago and pre-COVID. We had about 19 posts over a month period. As you can see, the ones that were liked the most, one was the House Call SIG video, the special interest group video, which I remember from the conference, and it was a really wonderful video. One was about the risks in geriatric patients for surgery. One was actually about an executive order that President Trump had signed to retire outdated practices. And where I kind of toot my own horn for GAPNA members is that this could have been something that people could have taken to a level of inappropriateness or kind of a polarizing political thing. But interestingly, people did not. People actually were really happy about the content itself because they were very happy that some of these outdated practices had been retired. And those of you who have been part of GAPNA for a long time or have been practicing geriatrics, especially in nursing homes, but just nurse practitioners in general, we all tend to be very aware of the old practices from decades ago that just no longer apply, that you just wish, like, just take those practices away. So I was really proud of our organization when they didn't turn that into something really weird. And then there was, of course, a post on home-based primary care and an article about medications that can mask dementia, which had a lot of shares. So generally, as you think back, of course, for GAPNA, it makes sense that these types of posts got a lot of attention. And then those other organizations, if you knew the names of them, it would probably also make sense why their types of posts got certain types of attention. And of course, I have to put Deborah Dunn's face here. And if she doesn't like it, that's just too bad. But that was one of our most popular, most commented on posts last fall, just talking about Deborah Dunn. And I think in part because we all kind of knew who she was. We were all excited. It was right after the conference. So those types of posts got a lot of attention. There we go. I forgot that I made that nice little purple box for you guys. So here are some general observations just to kind of summarize how I felt about what I felt in GAPNA social media as well as the other group social media. Overall, these more nurse-centric organizations tend to have more Facebook followers than Twitter, and that one group didn't even have the Twitter. So that was also a good reason for me to choose to focus on Facebook with GAPNA and not another outlet. The quantity of posts does not seem to correlate with the quality or the level of engagement, which is something that Celeste knows about very, very well, and she taught me on early. The most liked or the most popular posts did seem to have some type of emotional element or maybe a personal connection, maybe a member feature or kind of a hot button issue type of thing. But that doesn't mean all the posts have to be that. Some organizations did have a lot of engagement, but they also have a lot more followers. So you know, try not to compare what GAPNA does with a group that might have 100,000 people following it. If we have 4,000, obviously just by nature, that group was probably going to have more attention. Of course, avoid polarizing topics. So those articles that got the bad attention probably shouldn't be posted in a professional organization, and just avoiding those clickbait type articles, those articles that don't have credible sources, the ones where when you go there, they look kind of weird, they don't look like they're written very well, or the content just doesn't really make sense. Just avoid those. And I will say, looking at GAPNA social media, we never have that negative type of attention. We never have the polarizing stuff, in part because Celeste is so good at what she does. But I did feel like we had a good amount of quality content. We really had more engagement than I expected to have. More people liked, commented, or shared things that I really expected it to have. So I actually thought that we were pretty well-rounded to start off with. So had a good place moving forward to think about, it's already good. How can we even make things better or just try even more new things? Here is something interesting Celeste sent me early on last fall, kind of a snapshot of the viewership of our GAPNA Facebook page. So you can see over here on the left that, of course, most of the fans are women, which does make sense. Most nurses tend to be women. That doesn't mean we don't love our men folk out there, but that kind of makes sense. And you see the biggest blue bars are ages 35 to 54, which is wonderful. So what I want to make really clear, and what I did need to make really clear as I hopped on committee calls and talked to people over the course of the year about diversifying content is, we love this category of people. We do not want to move the viewership out of these categories, if that makes sense. But if we can make things that people in 55 to 64 and 25 to 34 really enjoy, we'd love to see that viewership increase for them, but by no means, do we want to take away interesting things for this age group, if that makes sense. But it does make sense when you see when you see the percentages of who's looking at this stuff the most, it does kind of make sense for our organization. So one of the things we really thought about was, what are some new things we could try that might capture this category, kind of the 18 to 24, 25 to 34, your younger nurses, your new graduates, your students seeking employment, students seeking organizations to join so that they can have professional benefits. That's kind of the category we were thinking about. But again, we value all the categories. So something I want to make sure you guys know is that our GAPNA members are incredibly active. These are just a very, very small number of examples of things that GAPNA members are doing. And I can tell you that I hopped on committee calls, I hopped on a chapter leadership call, and I got to hear about all these amazing things that GAPNA members are doing across the nation and even internationally. And it is really hard to capture all of that. We aren't necessarily capturing all of that, but you'll understand why a little bit later. But just to let you know some of the really wonderful things that they're doing, we have people who are being featured on podcasts for other national organizations, such as Joan Carpenter. We have people like Justin who are being inducted into being inducted as a fellow of the American Association of Nurse Practitioners, which is an awesome accomplishment. And we have chapters like the Northern California chapter who are conducting member surveys and finding that what people value the most is professional collaboration. And so that kind of plays into your social media as well, because we have all these outlets to collaborate with each other. So we can always kind of tie that in. And during COVID, you may have noticed some videos being posted from GAPNA. Deborah Dunn was interviewing some of our members about some of their work and just the environment that they were in. And this is Ron, one of the other Leadership Institute fellows that she interviewed, and she did a few more videos. And we have members who are being published, like Dr. Ann Kriebel-Gasparo, who I've just kind of stumbled upon these things sometimes, I stumbled upon Joan Carpenter's podcast when I was going through my other social media. So as I would see things on Instagram or Twitter or just even random emails, I would say, wow, this is something really great. Let's feature it. But it's a lot to kind of sort through, but I just wanted you to know that all of the members are doing really, really wonderful things. Something that Celeste sent me to share with you guys is that during National Nurse Practitioner Week last fall, they did some really, really awesome posts, and they had quotes from some of our members about why they love being a nurse practitioner. And this was something really simple that she did, but look at how many people it reached and how many engagements. And this was huge. This was by far, I guess, Celeste, would you say by far kind of the most popular?
Yes, it was. And often, sometimes the simplest posts get the most reach. And we often find too that after a post like this, then other posts after it are seen and have more reach as well. It's sort of a circle. So, when one post goes really well, those that follow it may go well too.
Wonderful. And something Celeste and I worked on that was new that we wanted to try this year that was that was her idea, props to Celeste, was to try something like a Fun Fact Friday type of thing. So I spent a little time compiling some facts related to older adults or the geriatric world, and she started releasing these every Friday facts onto the social media. For example, this one about the population of people age 60 and over. So this is something new we tried that we thought, hey, let's just kind of see how it goes. And if you've seen it, I hope you like it. I think the graphic is really fun. I love it a lot. And here Celeste has provided a snapshot of kind of what that looks like. So you can see she's highlighted the ones that say Fact Friday, and they do tend to have more of a reach than the other posts. So I think that's fun. Everything we post might not have that, but I think that this was really fun to try, and, you know, we'll kind of see where it goes, but it's interesting to see, you know, kind of the viewership of how that works. You know, I'm not quite as familiar with this. I don't know, Celeste, do you have anything else you want to add on this slide?
Yeah, sure. So I'll note that the Fact Fridays are actually images that we're sharing, whereas a lot of other times our posts are link shares. And generally speaking, on social media and specifically Facebook, videos get the most hits, then images, and then links, and then plain text. So, you know, whenever I can, I look for a way to create an image. So instead of just posting the fact and not, and you know, it just stating it as a status update instead of creating an image, that would get much less views. And again, you know, from a GAPNA leadership perspective, from a national office perspective, one of the reasons we want these little things to get views is then it helps our other posts in Facebook's algorithm get more views. So even though it could be viewed as like a, you know, kind of a silly thing, the Fun Fact Friday, then hopefully they'll see another post that is much more important, that we'd much prefer they see. And doing these little engagement bits can help overall.
Yeah, totally agree. And I think too, for me personally, if I see Fact Friday for the first time, I say, oh, that's kind of cool. Maybe I like it, see more stuff. Then I know that these people know what they're talking about. So if I need to know about geriatrics, hopefully that would clue me in to say, wait, I saw this thing by this group called GAPNA. What are they all about? And maybe lead us to the website. And then there you go. You've got some more attention. So I've really enjoyed doing the facts for sure. So there's always some good and some bad with social media, of course. The good is that you can have aggregated content. You have the connection to other people, to resources. You have a platform to share your voice or to share your cause, to get that message out there. And one of my favorites, sharing the heartwarming stories. I love seeing all the fun stories that make me cry when I'm in bed late at night looking at my Facebook, right? But there's always some bad associated with it. And, you know, we want to make it clear that even though there's a lot of bad, you know, we are promoting the good content. GAPNA is not promoting the bad content. The bad is that, yes, it can be a major time waster. Yes, you can totally have fake news. Things can be very controversial. I saw that when I looked back at some of the posts and some of the other organizations. And yes, there's some really awful, terrible stuff that could be shared out there. So this quote Celeste provided is really good, that says science does not have a moral dimension. It's like a knife. If you give it to a surgeon or a murderer, each will use it differently. So you can apply this to technology and say that maximizing technology's benefits while minimizing harm is especially important today, but has plagued society for centuries. We worry about junk on the internet, but we used to worry about junk on TV. Before that, we worried about junk on radio, film, books, newspapers. So this is just another challenge, but another challenge for us to kind of forge through and use in a way that's really beneficial to us. Celeste, do you have anything to say on this?
Yeah, I would just add that one of my favorite things about social media is that it's a platform that can give people who would normally not really have a voice a broad reach. So if you think about before social media, you know, say 20, 30 years ago, if you had something important that you wanted a large group of people to say, how would you go about doing that, right? You'd have to hope maybe you could get an article in print somewhere. But what an opportunity for our organization and for our members, that, you know, one post could go viral, one really great story or really great piece could give the organization some great coverage. And even just for our members, you know, if you're advocating on behalf of something, whether it's a volunteer cause or a political cause, there's great opportunity for you to have really broad reach with social media that did not exist years ago. So that's one of my favorite things about social media.
Awesome. Thanks so much. So some lessons learned from my project and just thinking about a strategic plan. I am a very by the book, mapped out kind of process person. I like to know where stuff is coming from and what I'm doing. So this is kind of a picture of my brain of, okay, we have all these members out there in GAPNA. We have people doing amazing things, and we should have special interest groups submitting content and different committees submitting content and different members submitting content, and all that would funnel in a lovely way either to a committee like the communications committee or GAPNA members or something like that, which would then beautifully funnel to our content managers or our people like Celeste. It does not necessarily work that way in real life, is what I learned. I learned that managing social media is kind of hard. It's kind of difficult in the sense that, how do you really capture all the wonderful things out there and present them in a way, as well as present them in a way that's applicable at the time. We all know that things can change really quickly. So what you post on social media today might not be applicable 2 weeks from now. And I think we kind of see this during COVID. Which guidelines were posted back in March are not necessarily the guidelines that were posted today. Just this month, it's actually September, just last month, August, in Georgia, the Georgia Department of Health released yet another guideline for long-term care nursing homes. So just kind of keeping up with that can be very difficult. And I really did gain an appreciation of Celeste's work and what she does and how much she has to kind of filter through everything and get all that presented in a really awesome, lovely way. So I have to say, I don't know the perfect answer to how we really gather everything good from GAPNA and get it there. It doesn't necessarily have to work in the box the way my mind works, but I'm speaking to you if you're watching this, if you're interested in these kinds of things, if you're interested in communications or social media, join us, join the team. We'd be happy to have you. There's so many different things we could possibly do out there. There's so many different modalities for doing this. We are always open to new ideas.
Thank you so much, Brett.
Yes. Do you have anything else you want to add?
I would just add that, yeah, if you're interested, to certainly reach out to the GAPNA National Office. With social media, there's no silver bullet. What works today may not work a month from now. And sometimes we might try things and think that they'll go really well. And then we find out, oh, nobody really liked that. An example is I work with another organization and we said, oh, let's try Throwback Thursdays. I'm sure you've all seen those hashtags, right? Like that seems relatable, trendy, current. Well, there was a huge flop and we saw engagement and likes go down. And I was like, oh, okay. So, if you ever have an idea about how GAPNA social media could be better, or you have suggestions, just reach out to us because we're always willing to give it a try. So that's all I've got to add. Thanks, Brett.
Awesome. Thank you.
All right. Thanks, everyone.
Got a couple references here. And here are mine and Celeste's contact information if you want to contact us outside of this, or you can find us in the exchange.
Mm-hmm.
Thank you all for joining us, and I hope you guys enjoyed all of the conference.